Good morning, dear students. Let me share with you about one of the topics that we are about to discuss is the introduction of biomechanics. So once in a while, I will be having a chance to video about our lesson. So just for now, I'll be sharing with you this PowerPoint presentation that will talk about what is biomechanics. Okay. Start with, let me share with you the screen for me to discuss about the basic of what is biomechanics. Okay, so this is an introduction to the study and analysis of human movement, as we all know. So one of the prerequisites of our biomechanics is the fundamentals of anatomy and kinesiology, or anatomy and physiology, which you have discussed, or you have taken this course last year. So during the past decades, the term biomechanics has emerged as an area of inquiry into the sports science domain. So because as we all know that this has been a relationship with the physical injuries that has been experiencing most of the athletes, and wherein trainers needs to know about biomechanics in order to prevent some of these illnesses or some of the injuries that may occur during the games, during performances, or sometimes during the training process. So to start with, biomechanics is also based on Newton's law and involves the study of motion of bodies, and human movement and analysis is also needed, and also an interrelationship among the forces acting in these bodies. So as we go on further with this semester, we're going to learn more about Newton's law and how the movements of the body occurs and how we're going to analyze our body movements. So biomechanics, bio meaning living. Okay, mechanics is the force and effect of each movement that is being applied in terms of speed and forces. So the application of mechanics to the living organisms involves the principles of anatomy and physics. Even one of the branches of science is also involved, which is the physics in the description and analysis of movement. So it has many diverse applications to all biological systems, and the study of biological structures will also come in the process and functions by applying the methods and the principles of mechanics. So since we are dealing with the analysis of human motion, we also need to know what are the biological structure of each organ, particularly the muscular and the skeletal system. According to Hay 1995, the science that examines the internal and external forces acting on the body and the effects produced by these forces. So it can either be kinematics or kinetics. So why learn about biomechanics? As I have mentioned to you earlier, when you're in the process of coaching or when you're in the process of teaching, so you need to know basically how the movement of each body affects the forces and how you're going to train your athletes in order for you to have an effective movement and performances as well. So the areas of studies includes also research and practice, like sports and exercise sciences, which I know that this is particularly your course. This also involves in coaching, like the diploma in sports coaching. You're also they need to know also about this. The ergonomics, the equipment design also is very necessary in order for you to know how are you going to organize, how are you going to format, how are you going to plan the training process of your athletes or your students. So the gait and locomotion, or what we call the movements of our body, such as simple as gait walking or sitting locomotor and non-locomotor activities. Now, when we go further with this branch of studies like orthopedics, rehabilitation, physiotherapy, occupational therapy, this already involves more broader aspects of this branch of biomechanics, because it's not only in sports that we are going to use this, but we also use this in other forms of like occupational therapists, whenever most of the athletes, like national athletes or even international athletes, may experience some injuries in the future and therefore they would need to go to physiotherapy for rehabilitation, and then later on they can go on for the occupational therapy wherein they can regain their skills little by little. Now here comes also the prosthetics and orthotics. Because of the massive injuries, sometimes they would require surgery after certain injuries that might occur during or a fracture during the games. So they need to have, these are the massive or these are already extended disabilities that prosthetics would come in. And of course, motor control is also necessary, and then the computer simulation in the advanced in the advanced training nowadays that are um, shall I say going on now. They are using this computer simulation in order for them to analyze furthermore each of the movements. Even if you're going to experience, to go further reading or watching videos about how Manny Pacquiao came into be a very competitive athlete, it's because of there are some computer simulation that has that they are trying to study more about how are they going to have a good performance and quality in terms of movement and terms. So now moving on, this is an example of body movement wherein you can see the load of movement. So this is actually lifting a certain amount of weight from the body, and then you can see the angular or the angle of the body. The support movement comes from the back of the body, and what are certain movements that are required here. So this is just an example when you are doing the preparatory position whenever you're doing example like bowling. So next is this is a sample movement analysis wherein the center of mass is the center of your body. Then this is a formula wherein we're going to tackle it in the end or in the middle of our lesson. So these are the degrees, the angular degrees, the right hip angle, which you can see here. This is the process of like if this is the preliminary movement, meaning this is the primary way on how he is lifting this weight, which is the blue tail here. And then it is positioned in a 0 degree. So this is the angular displacement wherein it also affects the force and the weight of the object that is being carried. So this is a graphic analysis of a certain movement wherein this is considered to be as the preliminary. Now, when you say mechanics, or rigid body mechanics are based on the assumptions that a solid body is considered to be a rigid body if the distance between the particles remains fixed when a force is applied. So this is actually in figure 2, this is a force that is being used, the P1, P2, and P3. So when a force is applied, the distance between the particles remains fixed. So now when we say segmental analysis, we often make the assumption that a human skeleton can be represented as a series of links. So researchers have used everything from cones to spheres to form the links which best approximated the complexity of the human body. However, by far, the most widely adopted and simplest link system representation is a statement. So that's why as we go over with our movement analysis, I have given you a task to draw a statement wherein you're going to do three movements, the preliminary, the action, and the follow-through. So this is an example of a combat game. So there's the opponent and there's the defender. Okay, so this is a stick example of doing the motions and which particular angular motion force that is being applied by these two athletes. Okay, so when you're going to go further with this, you're going to do this as in slow-mo, then you're going to calculate what is the speed, what is the time allotted, how many seconds in doing the preliminary or the preparatory phases and going to the certain action which is the kicking. And the follow-through is when the one of the body or body movement is going to lower down from the gravity. Okay, so now this is also an example of an activity that is being used, which is hammering. So how many points do we have here? So we have 1, 2, 3, 4, 5, 6, 7, which also includes the object. And then the stickman uses straight sticks to represent each of the links, as I've mentioned earlier. And in any case, regardless of the shapes that are used, we also make the assumption that the human link system is a system of rigid bodies connected at the joint. So if you're familiar with the skeletal and muscular system, so these movements can just come along and to be further analyzed with the different movements of the body. Then you can subdivide this, like for example, we have how many stickman? We have 1, 2, 3, 4, 5, 6 stickman. So I can assume that the preliminary goes for the first one. And then while lifting can also be the preparatory, the first angleman, and then the preliminary is the second. Third, fourth, and fifth can be the action that is being done, and then the last one is the follow-through during the landing. Okay, so the rigid body, this is a sample figure 3 diagram that considers the rigid body mechanics. It can be subdivided with kinematics, kinetics, linear, curvilinear, static dynamics, and then to the angular and the parabolic. So later on, you're going to know more about this kind of movements because our body moves differently from one station to another. When we say kinetics, it examines the causes of motion, the internal and external forces that cause motion or cause a body to remain at rest, and the interaction between these forces. So these are the two branches of kinetics, which is the static and the dynamic. So when you say kinematics, this describes the motion of a body without reference to the forces causing it. So kinematics examines how, when, and where the body moves. For example, variables such as displacement of a ball, the velocity of the skater, and the acceleration of the free leg all describes motions and are kinematic variables. We classify the kinematics motion according to the pathway it takes. Movement may be linear, curvilinear, or a combination of these two. So curvilinear motion can be further specified as angular or parabolic. So when you say the linear motion, these are the movements of the body straight line or along with a straight pathway. So from the word itself, line, or line, these are the line movements, or motion is also produced with external forces that is applied directly to the center mass of the body. When you say curvilinear, these are motion along a curved path. This is already when the movement is already being applied. Then when you say angular, from the angle, the word angle itself, these are angular motion takes place when a body moves along a circular path about some axis in space. So this axis is known as the axis of rotation. Angular motion is produced when the forces are applied away from the axis of the rotational body. So this is the very basic when the man is in a 90-degree. So while pulling and pushing the force. And this is the angular displacement. As what you can see, this is an example of a golfer. And then we have a diagram here, which is the angular displacements, the degrees in the right elbow angle. Because as you observe that the forces is being applied to the ball comes from a more than 90 or 140 degrees from the point of view. So our body limbs are able to rotate about the joints because all of our muscles are attached to some distance from the center of the joint. So that's why we are we need to know more about our human system, which is anatomy and kinesiology or anatomy and physiology, which is also a very good basic form of before studying biomechanics. So what do we mean by parabolic? These are bodies which are projected into the air with a show of parabolic path and are governed by the law of projectile motion. When you say static, refers to the fluctuation where the body or object remains at rest or is moving at a constant speed in a state of equilibrium. So when you say equilibrium, it is a balanced state which there is no acceleration. So equilibrium can be termed also as balance. When you say dynamics, deals with the changes in motion brought on by the unbalanced force. So there's already a movement. While the quantitative versus qualitative, both kinematics and kinetics can be analyzed using a quantitative or qualitative approach. The quantitative analysis requires a numerical equation of an individual's movement. Qualitative analysis involves a systematic analysis of movement based on the biomechanical concepts, but without actual measurement. So when you go for quantitative, you're going further with numerical equations like how many degrees, what is the angle of this certain movement, how many seconds can be applied for the preliminary or for the action, and then the follow-through process of the three phases of movements. When you say the qualitative analysis, this involves only the systematic analysis of movement. Which particular bone, which particular muscles are being used whenever you are lifting or where you are hitting the bat. So the methods of acquiring this data, we have video acquisitions like the activities that I gave you. There's the 2D or the 3D. So points are digitalized manually or by attaching reflective markers and digital. So you can go for slow-mo, you can slow-mo the video, then later on you're going to itemize how many seconds can be applied for this certain phases of movement. Number 2, we have the optical acquisition, which is radiant control environment. Markers on the system that uses 2 to 12 cameras. These are already high technological methods on how we're going to use. Then the analog acquisition, something from force platforms, EMG, or other devices. These are already high scientific technology that may not be applicable for us. So, can be integrated with video or 3D optical. But if you go further for studying after you completed your business program, then you can further go for some specializations. Okay, so videography is very important. Like for now, this is already very common because most of us have cell phones. So we can therefore do, or even some of the cell phones have this this has the capacity to do the slow-mo movements or slow motion. So this is an example of a little boy holding a ball. So this is the qualitative. You are tracing the certain movement. So the boy is lunging forward with the left hand in front. Then the navel is the medial of this movement. While the degree is mostly in 100 degrees, and maybe the time and measurement as exerted by these two labels, which is tracing from film of a young child throwing a ball. The center of the gravity has determined using the segmental methods. Then the tabulations are listed in, while the X is the endpoint of segment, and the that one is the segmental centers of the gravity. So this is where you're going to start to analyze using a photograph on how you're going to analyze the different movements, different joints as you observe. For every X letter, so there's already this point of segments wherein you would like, if you would like to analyze. So some questions that may require quantitative video analysis: an objective of prescribing an orthosis usually improved by function of patients. So this is more on the further side of biomechanics. So how can we determine if the use of foot orthotics is correcting the severe pronation exhibited by a patient? So these are some of the disabilities that may have. These are the club-footed individuals that are born naturally with this formation. And then by using this orthotic correction marker, they can make their foot straighten. Okay, so this is more on the qualitative analysis. Videotape, digital, and compare joints angular displacement throughout the stride, meaning the movement of the foot, can also be analyzed. So, hydro workers are required to lean out of the lift to repair the lanes. The action leaning and working to the distance foot injuries loads the lower back injury. So this comes in whenever you are dealing with some injuries, back injuries. So this is where hydro workers come. Hydro meaning water, So how can the lift be modified to reduce the risk of injury? These are also in terms of the quality of movement that is being applied. So the EMG, these are the electrical magnetical graphs that are being used. These are usually in most of the developed countries, they are using this. So the exercise is best for rehabilitation as part of a particular muscle. Yes, whenever there's a strain or strain or more further injuries that are experienced by the athletes or some of the trainers or the trainees, so these are some of the rehabilitation exercises that are being conducted or doing as a rehabilitation program for post therapy. So these are the electromyographs. These are myographs meaning the muscular, the electrical muscular action of your organ, which is particularly your muscles. These are raw EMG, full wave rectify. These are the linear envelope and then the integrate cover over contraction. This is how they record what is the electrical movement of your muscles. And then this is an example of EMG, but for today these are obsolete. These are from how many decades pa? But then these are the computerized tomography that we also have in some of the hospitals here in our country. So force analysis, how much force is being applied in the horizontal direction, Fx, Fy, Fc. These are the angular analysis of the movement. So next, these are much more complicated mechanical analysis of human movement. These are joint force reaction or forces that are being used. So this is how you're going to analyze this certain movement. So qualitative analysis involves a systematic analysis of movement based on the biomechanical concept but without actual measurement. Because you're measuring the quality, not the quantity in terms of numerical form. So what does QA process include? This is a technique error. What are the mechanical concepts or govern specific parts of the skill? What the critical features of the performance? What is the best observation strategy? How do you detect errors in performance and remediate? Okay, so this is you're going to go further if ever, like for example, there are some of the boxers that are really going over with the video performances of their competitor whenever they're going to go on for a certain training, because they want to study more further what are the skills, what are the techniques that are being used by their opponents. So therefore they can study it and they can label it, and further they can do some strategies on how you're going to combat this opponent. So, according to Sally, a powerful outside shooter of the high school volleyball team has been out for 2 weeks in the mild shoulder bursitis, meaning there's an injury. So, but has recommended received her position clearance to return to practice. So the coach notices Sally's spike are traveling at a low speed and are being easily handled by the defensive players. So this is an example of Sally who have already a bursitis, which is one of the mild shoulder injury that are mostly experiencing by the volleyball players. So once there's already an injury in the shoulder, the forces and the forces being applied to a certain ball has been lesser. It lowers the speed, it lowers the force, so the defenders can easily took it over. Okay, so anyway, so this is just a short record of our topic, which covers in weeks 2 and 3 the human body and orientation, which is an overview of biomechanics. So thank you so much for listening, and I hope that you're going to go on with our Google Classroom for further. Thank you so much, and this is once again your teacher, MJ Bautista, for your biomechanics. So thank you, and have a nice day.